Hello guys, today I'm going to talk about a condition which is called trigger thumb, which can be quite disabling and extremely painful because it affects the function of your thumb, and thumb is responsible for majority of the hand function. In some evidence they will say around 70 to 80% of the functions of the hand is predominantly thumb. So if you have a patient with trigger thumb, they are not able to use the thumb and hence they are not able to do their day-to-day activities. So today my goal is to show you a patient and tell you or to teach you how to diagnose a patient with trigger thumb. So when you are seeing a patient who complains of pain across this area, so she came to me with pain in this area and my resident presented to me that she is complaining of pain, and he examined for base of thumb arthritis, he examined for a metacarpophalangeal joint, and he said that the diagnosis is most likely base of thumb arthritis. But base of thumb arthritis affects here. If a patient, especially elderly patient, elderly female or diabetic patient is presenting to you with pain across the metacarpophalangeal joint, then always think of trigger thumb, irrespective of whether they give you a history of catching or not. If they give history of pain here plus catching or clicking, then diagnosis is extremely obvious that it is trigger finger. But many times patient will not give you a classical history of catching or triggering. So patient, if they present with pain across the metacarpophalangeal joint of thumb, first thing, think trigger thumb, especially in diabetics and elderly female, because it's 5 times more common in diabetics than normal population. So if you turn across this area here, now the first thing you will notice is on examination you will find nothing, absolutely nothing. But when you press this pulley here, if you see here, she winces. Every time I'm pressing it here, she complains of some discomfort. And if you feel the normal thumb and this thumb, you will feel a hard nodule. So if you feel a nodule at base of the thumb, if you feel something here, and if you feel a hard lump and it is painful, then it is trigger thumb. The second thing you can do is move the thumb, flex and extend, flex and extend, and I can see the catching. And I can feel the grating sensation because my index finger is at the pulley. So I'm pressing it here and extending it here, and every time I'm pressing and extending, I can feel grating as well as triggering, the mild triggering that patient did not get. So on this occasion, she didn't give any history of triggering. See, there are occasions where this thumb can be completely, in later stages, the patient will come to you in this condition and they say they cannot get the finger straight because this is stage 4 and the finger thumb is locked. So until you do a release or give local anesthetic, you will not be able to get it straight. But the message for this video is patients who complain of base of thumb pain, which is not traumatic, atraumatic base of thumb pain, always examine for trigger thumb and you will find this is the diagnosis. Now I will talk about the management, how to manage it. So if you see a patient of trigger thumb, if it's early stages, then you can give some non-steroidal anti-inflammatory medication, and they usually do get better, but almost, I would say roughly 50% of them will require some further intervention, whether it is in form of injection or in form of release, surgical release. So if the anti-inflammatories are not working, you have tried, given for a few weeks, if it doesn't work, then the next stage is that you give a local steroid injection across the pulley. But you give only once. You cannot repeat the steroid dose. So whenever you are treating a patient with trigger thumb or trigger finger, tell your patient that I am going to inject today with some local steroid. If it makes you better, it's absolutely fine. Otherwise, you will need a small operation. Never ever repeat the steroid injection because then you increase the risk of tendon rupture, which can be catastrophic. So one injection, if it's fine. If it doesn't, then a small procedure of releasing this pulley. And I have already uploaded a video for trigger thumb injection, I think, and also a trigger thumb release. So you can follow those videos to see the management part. So viewers, if you have a patient who has got atraumatic pain across the metacarpophalangeal joint, diabetic, like this one, this patient is diabetic, and complaining of pain at the MCP joint or any other finger, MCP joint of any other finger, then always think of trigger finger or trigger thumb. Examine the A1 pulley or the oblique pulley, look for any palpable nodule, look for any tenderness, take passive range of motion, and you will feel a crepitus and grating, and your diagnosis will be extremely easy and obvious. So I hope you find this video useful. If you ever diagnose a patient of trigger thumb, tell me how you have managed it, and I hope you find this video useful in your clinical practice. Please do share our channel, please give us a thumbs up, and please do subscribe to our channel. Thank you.